Hello, everyone. My name is Lányi, and today I'm going to talk about my PhD, which is about the study of potential neurophysiological and neuroimaging markers of schizophrenia. I'm a cognitive psychologist, and I work at the Department of Psychiatry and Psychotherapy of Semmelweis University. And my vision is to build a comprehensive framework or network of various biomarkers for schizophrenia spectrum disorders. And when I'm going to talk about later about my specific projects, you will understand why is it important to find biomarkers for psychiatric disorders. In order to reach that vision, my mission is to study potential biomarkers with various neurophysiological and neuroimaging methodologies, such as transcranial magnetic stimulation, which is TMS, or EEG, or functional magnetic resonance imaging. I would also like to apply computational psychiatry models in order to better understand my results. So here you can see my specific goals, which I aim to do in order to reach my mission. In my first study, I study TMS combined with electromyography as potential biomarkers. And in the second topic, I'm going to study EEG event-related potentials for schizophrenia. Both methodologies are systematic review and meta-analysis. So here I'm going to talk about my first meta-analysis. So why is it important to find biomarkers for schizophrenia? Schizophrenia is a very severe psychiatric diagnosis or disorder, which has a lifetime prevalence around 1%. But this prevalence has grown and shown an increase in the last couple of decades. Schizophrenia can be characterized by positive, negative, and disorganized or cognitive symptoms, which means that the disorder is very heterogeneous. And this kind of heterogeneity is poorly explained by current diagnostic methods. So what are the diagnostic methods in psychiatric diagnosis today? It is based on DSM, the Diagnostic and Statistical Manual for Mental Disorder, and the diagnosis, or the gold standard way of diagnostics, is a structured clinical interview. And the problem with structured clinical interview is that it leads to bias. Every clinician evaluates interviews differently, which can result in heterogeneous symptoms and heterogeneous diagnosis. So therefore, we believe that it is very important to find biomarkers in schizophrenia, but so far we don't have any leads on it yet. One idea, which could be a biomarker, is TMS combined with electromyography, which can measure cortical excitation and inhibition in schizophrenia. And research results suggest that this kind of excitatory-inhibitory imbalance could be a pathophysiological characteristics of schizophrenia. So my aim with this meta-analysis is to study cortical, excitatory, and inhibitory TMS-EMG protocols. And here you can see my PACO. My population is, of course, schizophrenia compared with healthy control group. And my outcomes are two inhibitory outcomes: short interval intracortical inhibition and long interval, and one facilitatory, which is intracortical facilitation. And there is one more inhibitory process at the end. I'm planning to do a subgroup analysis based on medication. The clinical implication of this research is potential biomarkers for schizophrenia. So here you can see my search key and the results I found with these search keys. And here you can see my flowchart of selection. I finalized the selection together with my partner, David Balog. And here on this graph, you can see the different articles that had the different various outcomes of mine. And here you can also see my progress. I'm proceeding with the data extraction, and I'm going to finish it very soon. So moving on to my second project. In the second project, I'm going to study EEG-related potential biomarkers, so event-related potential biomarkers in schizophrenia. So the background about schizophrenia and the problem with psychiatric diagnostics is the same as with the first meta-analysis, but here I'm going to study EEG. And what are event-related potentials? Event-related potentials are time-specific EEG activations, which can be measured during a task, a cognitive task. And this is very important during psychiatric evaluation, that there is a tool that can assess neurophysiological correlates of cognitive processes. That's why it could be useful for schizophrenia. One main event-related potential that I am going to focus on is mismatch negativity, which can be studied with the so-called oddball paradigm. On the graph, you can see how the oddball paradigm goes. It can go either with an auditory or a visual stimulus, where there is a pattern of standard stimulations, which is broken by a deviant stimulation, either a noise, which is higher on the pitch, or a different kind of visual stimulus. And this kind of deviance results in a change of EEG activity, which can be calculated as mismatch negativity. Mismatch negativity has been studied widely in schizophrenia, and this is one of the most established potential biomarkers for schizophrenia. However, there is no clear protocol how to study them, and there are no results whether medication, antipsychotic medication, changes mismatch negativity, and or whether it is specific to schizophrenia diagnosis itself. So here my question framework is the same as in my first meta-analysis, only my outcome is different, and my outcome is the amplitude and latency of event-related potentials, visual and auditory mismatch negativity, and P300, which is also event-related potential related to the oddball paradigm. The difference is that in this oddball paradigm task, the participants are required to listen to the deviant or search for the deviant response. I'm also planning to do a subgroup analysis based on medication or antipsychotic medication, and my hypothesis is that these event-related potentials would be possible tools to predict schizophrenia diagnosis. So here you can see my summary of the two projects. I'm planning to complete them this year. And thank you for your attention. I'm looking forward to your questions.
Thank you so much, amazing presentation. My question would be, what does exactly this TMS-EMG test look like in a clinical setting?
Okay, so basically it's a very, it's a non-harmful, non-invasive brain stimulation technique, TMS. It can be used for therapeutic purposes as well. You can imagine it like sitting in a kind of dentistry chair, and then a TMS machine, so the magnetic coil is placed on your scalp, and so participants don't even feel the stimulation. They only hear a clicking noise, and maybe after that they can feel some dizziness or a headache. And then during the task, electromyography is attached to their fingers. So when the motor cortex is stimulated with TMS, you can measure the twitch on the fingers resulted with the magnetic stimulation.
Thank you so much.
I'm curious that you are planning subgroups in your second project based on drug positive or negative groups. And how do you know, is there any other characteristics of schizophrenic patients that are affecting the signs that you are looking for, the P300 or the mismatch negativity, like symptoms, positive symptoms, negative symptoms, the distinct symptoms in one patient and in another? Can it be measured?
Yeah, thank you for the question. I'm also planning to do a subgroup analysis based on positive and negative symptom scale, which is a standard measurement for schizophrenia symptom severity, and it differentiates between positive, negative, and cognitive symptoms. And mismatch negativity is could be affected with all of the symptoms, but it can be related to cognitive processes. But it's, so it is a pre-attentive process, so it doesn't require so-called executive functions or higher level cognitive functions such as working memory or attention, and these are measured with the cognitive symptom scale. So that's why it's not necessarily related to only that.
Thank you, Orsi, for the great talk. I have one question. You mentioned that possible background of schizophrenia is the imbalance between inhibition and excitation. This is kind of a hot topic in all the psychiatric and neurological disorders. With TMS and MEG, can you capture that the imbalance is generalized or local or focal? Because obviously if you add the EEG, you can.
Well, that is the thing, that with this kind of EMG method, you can only measure TMS-evoked stimulation in the motor cortex or derived from the motor cortex. But it is possible to combine TMS with EEG. It would be more valuable in case of psychiatric disorders. But for the meta-analysis, there is not enough publications. We are planning to conduct an own research with TMS EEG to study that.
Yeah, that can be maybe an original research to answer this question.
That is one of my plans. Yeah.
Thanks.